Hello, Trail Seekers, and welcome to another exciting episode of the Learn True Health podcast. We have a wonderful interview for you today with Dr. Rachna Patel, who's a medical doctor that specializes in helping patients around the world to transition into using either medical cannabis or using CBD products in order to help them sometimes even get off of pain medications. But a lot of people that come to see her have complicated issues, like parents who have children with autism who also experience anxiety. They've found that CBD has been very effective at helping these children lower their anxiety. Those who have complicated chronic pain issues, like fibromyalgia, and they're finding that even on multiple opioid medications that they're having a very difficult time managing their pain, they come to Dr. Patel and they have found great success in using her expertise. Now, I thought it was pretty easy. Just if you have pain, just start using CBD, or you have pain, just start using medical cannabis, no big deal. And in our interview, what I found really interesting is that there's a bit more finesse to it, that if you really want to use hemp and cannabis products as a medical herb, that you want to know some things first. You want to know how to ingest it, how to get it into your system. You want to know the measurement of how much you are ingesting, and you also want to know the contraindications and the side effects of if you have taken too much. It's not dangerous, but you should know the side effects. Who wants to experience side effects anyway from natural or man-made drugs? We want to make sure that we're taking something safely and effectively. We can easily overdo some CBD products. Now, there's also a concern about quality in the supplement industry, and since a lot of CBD products are expensive, we really want to make sure that our money is going towards products that are good quality and provide us exactly what we're looking for in the dose we're looking for. Now, I had a really interesting thing happen a few days before our interview, which I found to be just perfect timing. You know how the universe lines up to help us. Well, on Sunday, I was roughhousing with our son. We were playing together, building forts and laughing and tickling, and I injured my back. I don't remember quite what happened, but I injured my back. And Monday morning, I went to the chiropractor, and he said, yes, you did quite a doozy. I had basically torqued and twisted my pelvis. He said it's going to take a few days to recover. I was very sore, but instead of reaching for the Advil or for something stronger, I went for this supplement that's been sitting on my shelf from Eva CBD. I interviewed the founder of Eva CBD. It's a whole hemp plant supplement company. I interviewed Nicole back in episode 337. She has a wonderful story, including curing her dog's cancer using a whole hemp juice. So that was very interesting. She also cured her, I believe she had a form of IBS, and it was very painful for her, and she was able to reverse her inflammatory bowel issues using medical cannabis. And so what I love about her story is that they've really applied their lessons personally to their own health, and then they look to create a supplement to help others. So she had sent me a bottle of her supplement called, I have it right here, called Better Relief, the Eva Better Relief, and I hadn't been in pain when I interviewed her, and so I kept it, thinking, well, hopefully, I'm glad I have it. Hopefully I don't ever need it, but if I am in pain, I'll use it. So I came home from the chiropractor in tremendous amount of pain, almost unable to walk, just kind of like a 9 out of 10. And I took 2, and I drank some water. And of course, this is hemp, so it doesn't make you high or anything. And it took about 20 minutes for it to kick in, and I noticed that it really brought down the pain. I was able to relax, and I had some pain cream I tried using, but it really didn't feel like it was doing the job because this was a pretty deep, joint pain that I was experiencing. And then about 20 minutes after, like I said, after I took the Eva product, the whole hemp plant supplement for pain, that it kicked in and it started to go down. And then I was able to rest. My back started to relax a bit and the pain went all the way down to 0. And I noticed that if I'd get up and walk around a lot, it would kind of get agitated, but it wouldn't get sharp. It was really dulled. It felt almost like I had taken some Advil. It was that effective for me. And so I took it twice a day, every day. And I still have the back injury. It's still healing. But today is, better than the day before. And so it's been 5 days, and every day I've taken the Eva Better Relief. And each time I go from a lot of pain to very little pain to almost no pain, and then I have to, rest, and then it can come all the way down. That, for me, sells it, because I think I would have had to have taken a lot of Advil to have gotten the results, and I don't want to take Advil. It's the NSAIDs are dangerous for our liver. They actually inhibit the body's ability to further decrease inflammation. So having said that, I know a lot of listeners have told me they love the Eva CBD products. So I wanted to let you know that you could definitely go to the show notes of this episode, because I'm going to link my other interviews about CBD, which I think really complement this interview. And if you're interested in trying the Eva products, they have one for brain health, and they have one for nerve health, they have one for emotions and mood, and they have one, like I said, for pain. So they have about 6 different kinds. They mix herbs along with the whole hemp plant supplement, and you can get 20% off when you go to learntruehealth.com/Eva. So that's learntruehealth.com/EVA. And then you put in the coupon code LTH. And so thank you so much for being a listener, for sharing these episodes with those you love, especially if someone's in pain. I can tell you they'll be very happy to learn about this supplement. I've never used a supplement for pain that worked this well, so I'm really happy about that. And then the other CBD interview I did that I think really is interesting to listen to, in addition to listening to today's episode, is my interview with the founder of Naturale CBD, Jay Hottenbach. And he actually also gives us a discount. Now, he has a totally different product. So Dr. Patel actually sells a CBD product, and she talks about it in this interview that you're about to listen to. But each of these are different. So Dr. Patel has one that's a whole plant CBD tincture. And then the Eva CBD is actually like the entire hemp plant, but in powder form, so it's less adulterated. So it's a bit different. I think you're gonna get different experiences from each one. And then Jay Hottenbach's supplement, which is Naturale CBD, they guarantee that there's no THC. So then they have a process, and he explains it. And I think it's fascinating to listen to this one, which is episode 300. And I'm of course going to have the link to this episode as well in the show notes of today's podcast. What I think is very interesting is that he talks about the farming industry for hemp and the different qualities of plant and how they manufacture it to make sure that it is clean. Because as Dr. Patel talks about in today's interview, you really, buyer beware. There are some CBD oils out there that are filled with mold, fungus, pesticides, and heavy metals, and some of them contain very low amounts of CBD. So you're just basically taking a poison instead of a medicine. And Jay talks about that in our interview, episode 300. And for his discount, you can go to medterracbd.com, use coupon code LTH, and he gives 15% off. Excellent. Well, enjoy today's interview. I know you will. Please share it with those of your friends who are in pain, have anxiety, have problems sleeping. All these conditions benefit from medical hemp and medical cannabis. Excellent. Thank you so much. Have a wonderful day and enjoy today's episode. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 361. Well, we are back on the show with Dr. Rachna Patel, who we had all the way back in episode 49. It's it's been a long time. I can't believe it. Now we're in the 360s and and going strong. So welcome back to the show.
Thank you. Thank you for having me.
Absolutely. And you just shared with me that when you came in on episode 49, it was your first podcast interview.
Very first, and I was really, really nervous.
Well, you did not come across as nervous. I thought it came across as memorable because it was a really interesting interview about how you help your patients as a medical doctor with helping them to relieve anxiety and post-traumatic stress and pain, chronic pain, using properly administered medical marijuana. And now you're here today to talk about CBD, which is much more widely accepted than medical marijuana, considering people don't get high from it. And yet people are seeing great results with pain management and anxiety and sleep. I'm myself right now currently on a CBD from a whole plant, whole hemp plant medicine because I hurt my back on Sunday roughhousing with our 4-year-old. And I went to the chiropractor and he said, yeah, you were really messed up. My pelvis was torqued. I just did a number on myself and now just recovering, but I've been in pain and I'm really surprised at how this has been more effective than if I took an over-the-counter medication, and I don't feel dopey and I know I'm not hurting my liver. So I'm really relieved. I'm glad I had some in stock because I'm not normally in pain, and the fact that I went to it first instead of Advil, and I've had some really great results managing my pain while my back gets better. So I'm really a big believer in hemp, using hemp as medicine and the extract CBD as medicine. I'm really excited to learn more from you today. So since you've been on the show in episode 49, a lot has happened in your career as a doctor and a healer. Tell us about what's happened since and why you're so passionate about CBD.
Yeah, so when we last spoke, I was still in my brick and mortar practice in California. And since then, I have transitioned to an online practice because I was getting like phone call upon phone call from people all over the world who were basically like, teach me how to use this, mainly CBD oil because that's, what most people have access to. So I transitioned to an online practice. I've written a book in that time as well. The following on my YouTube channel has exploded. So tons that has happened.
Awesome. Very cool. And so now you can work from wherever you want. You were just mentioning to me that some of your recording equipment was in New Jersey. So I don't even know, where are you right now?
I'm actually in Austin, Texas right now.
Awesome. Very cool. So you get to travel and help people all around the world. Tell us a bit about that, about helping people online around the world versus one-on-one in person in your clinic. What's the difference that you found?
So I'm still doing consults online. They're still one-on-one consults. But the only difference is that rather than just working with people locally in the San Francisco Bay Area, I'm now working with people from England and South Africa and Indonesia and Canada. So all over the world. And what's interesting about that is that I have to customize and tailor the treatment options based on what's available in those particular countries, right? Um, in a way, it's a challenge, but in a way, it's also a learning experience. And you have to figure out how to be very, just basically think on your feet and figure out, okay, well, this is not available to them, so this is something that could work instead. Yeah, that's what the experience has essentially been like.
Awesome. Very cool. What can you share, without obviously saying anyone's name, can you share some stories of success in the last year working online with people around the world?
Yeah, so I have helped a lot of parents of children with autism. A lot of times these children, they tend to struggle with anxiety. And a lot of that anxiety is triggered when there's a change in routine. Any sort of change in routine triggers this anxiety. And in the worst case of scenarios, it can be, it can be aggressive behavior. It can manifest as aggressive behavior, oftentimes even physical. And with the help of CBD, these patients have, we've been able to manage the anxiety that these children experience, and therefore the sequela, of that anxiety that manifests, so working with that, working with severe pain, as well, a lot of back pain. A lot of these things like anxiety, chronic pain, insomnia, they're common to people all over the world, right? Because the human body is the human body, and the human experience is the human experience. And so there's a lot of commonalities there, that, this one medication can benefit.
Now, at what point did you start to really use CBDs? When we spoke, I felt like you weren't talking about CBD as much as you're talking about medical cannabis, medical marijuana, and the different, maybe using the different strains to get different results. And then how to use it was really important, like that just sitting there and smoking it was actually harmful, but that there's ways to use it that's less harmful and actually can be of benefit. So that was more what you're talking about, and now you're talking about CBD. So what happened in your journey that made you want to use CBD more?
So the thing is that actually I was always talking about CBD. When I would talk to patients, even in the context of marijuana, in terms of what combination of cannabinoids, what combination of CBD and THC they should be using, I was still talking about, amounts of CBD and amounts of THC. Then you had Farm Bill 2014 come along, which made CBD even more accessible, CBD derived from hemp even more accessible, right? And overall, if I had to break down the benefits of CBD and THC, in terms of percentages, I would say that about 80% of conditions benefited from high amounts of CBD, whether that high amount of CBD comes from marijuana or if it comes from hemp. And then about 20% of medical conditions benefited from high amounts of THC. And of course, there are conditions in between that do need both, CBD and THC to effectively treat the conditions. So it's something that I'd always been talking about, like I said, in the context of marijuana. But with the regulations changing and CBD becoming more accessible, it was basically more that I just started to focus more on CBD, and people still come to me with conditions where, CBD doesn't benefit their conditions. And so I'll outright tell them that, hey, you're better off using a marijuana-based product because you are going to get higher amounts of THC than CBD. And so that's really the context in which I speak. Even in the book that I've written, that which conditions benefit from high amounts of CBD, which conditions benefit from high amounts of THC, and which conditions benefit from both CBD and THC.
Very cool. Can you illustrate those points to us now? Like, I'm pretty sure most listeners will have an understanding that like CBD doesn't make you high. Medical marijuana, when it's activated, like the THC is activated, it's heated up. So it goes from the THCA to just THC. That's what makes people experience the high. But for people that don't want to experience a high and just want a medicinal herb, then that's the CBD. But can you go into more details and explain like what CBD is really good for versus medical marijuana?
Yeah, sure. So I just want to touch really briefly on this concept of the high. Mainly, there's two things that cause it, right? One is that the THC is of a significant potency in the product itself. And two is that you're consuming a certain dose in order for it to actually get you high, right? You're consuming excess amounts. If you don't consume excess amounts of the THC, then you're not going to get high off of it. And if the CBD is a lot higher than the THC, then you're not going to get high off of it. But in terms of conditions that are benefited by high amounts of CBD, okay, these are the most common conditions that I've encountered in my clinical practice. They include things like migraines and headaches, muscle pain, right? So we're talking about things like spasms, spasticity. Then there's nerve pain, okay? So for instance, back pain caused by sciatica, neuropathy that's caused by diabetes or chemotherapy, and even trigeminal neuralgia. Then we have anxiety, right? So the umbrella of anxiety covers all sorts of different conditions. We're talking about obsessive compulsive disorder, PTSD, ADD, ADHD, panic disorder, and also mild to moderate insomnia. Now, conditions that need, in addition to the CBD, some amount of THC include nausea and vomiting, lack of appetite, autoimmune conditions, right? So these include conditions such as psoriasis, rheumatoid arthritis, Crohn's disease, ulcerative colitis, lupus, severe nerve pain. Okay, so this is pain that's caused by conditions such as shingles and spinal stenosis. And then finally, severe insomnia as well. Okay, and this is specifically where the person cannot sleep unless they actually take some sort of, heavy duty medication, or a high dose of a medication as well. So that, I would say, in a nutshell, covers the conditions that are benefited by high amounts of CBD, and then conditions in which you do need some amount of THC as well.
Thank you for that explanation. Now, we've got some great questions in the Facebook group. I want to make sure we get to all of them. So yesterday I posted in the Facebook group asking if anyone had any questions for you. Listeners who aren't in the Facebook group, please come join us. It's a great community. Just search Learn True Health in Facebook. And so I know you've got the list of questions pulled up. Do you want to run through them?
Yep, sure. So let's see. First question comes in from Jenna. And Jenna is asking, what form of CBD is best for anxiety and depression? Thinking about trying pill form. Would this be effective? What dosage? Okay, so there's a couple different things I want to touch on here. First of all, let's look at anxiety and depression separately. Okay, so anxiety, like I mentioned, is one of those conditions that benefits from high amounts of CBD. Depression, on the other hand, benefits from THC. Okay, and that is because of the chemical pathways that these chemicals impact. Okay, so CBD tends to have an impact on serotonin levels, okay, which is what impacts anxiety. Oftentimes, what's prescribed for anxiety are what are called SSRIs, right? So selective serotonin reuptake inhibitors. And basically, these medications up the levels of serotonin in your body. So that's what's helping anxiety, is high amounts of CBD. However, depression is typically helped by high amounts of THC because THC tends to impact dopamine, right? And dopamine is one of those feel-good chemicals. Now, the important thing to know here is that impact of THC on depression is very transient, lasts for a couple hours or so, and then it dissipates. So overall, I would say when it comes to anxiety, CBD is a lot more effective than pharmaceutical medications. But what I found with depression clinically is that the pharmaceutical medications tend to have a better, longer lasting effect than the THC. Okay, now you're talking about form, okay? So there are a lot of different forms in which to consume CBD. There are edibles, there are tinctures, which are drops that you put under the tongue. You can also inhale it as well. And a lot of this comes down to, in terms of what's the best method to use, comes down to your medical history, right? So let me give you an example. I've had patients who've had gastric surgeries, right? So for instance, gastric bypass surgery. And in their case, they're not able to absorb edibles as well, right? They're not absorbing the CBD as well. It sort of just passes right through them. And in their case, what works better, what's more effective, is inhalation or using drops under the tongue. So that's what I'm going to tell you about that. Now, when it comes to dosage, that is what I found is it's a very individual process. And just to give you an example, right? So this is an example having to do with insomnia, but it can also apply to anxiety as well. So I had two patients. They both struggled with insomnia. They were otherwise healthy, right? No other medical diagnoses that they had. And they were of similar body size and body shape, right? So they had similar BMIs. And both patients tried the exact same CBD product, okay? And one patient ended up needing just 2.5 milligrams of CBD to sleep better, whereas the other patient needed 50 milligrams of CBD to sleep better. And I've seen this be the case with anxiety as well, okay? Now, there's a couple different components that come to play when it comes to using the right amount of CBD, right? So first and foremost, you want to take the strength of the CBD product into account, right? So what I'm going to tell you right now is on the market, in an ounce, okay, whether it's an edible or a tincture, you're going to find anywhere from about 250 milligrams of CBD up to 1,000 milligrams of CBD, right? So that's highly variable in terms of strength. And then the next job then is to figure out dosing, and then also taking the right frequency of CBD as well, right? You don't want to overdo it because you can develop a tolerance to it. So again, let me walk you through an example. I've had patients with, severe back pain, and nothing's really worked for them. They finally turn to CBD, and it does actually work for them. And they get overzealous. Okay, they overdo it, and then 2 to 3 weeks later, I'll get a phone call saying, "Hey, doc, this worked great, and now it's not working anymore." And that's because you can develop a tolerance to it, right? So basically, you've developed a tolerance where when number one, you're having to take higher and higher doses to get the same effect. And then you sort of reach a plateau, right? Where no matter how much you take, it's having no effect on you. Okay. So those are some general basic guidelines that I would give you in terms of answering this particular question. Should I just roll through the next couple of questions?
I actually, I'd like to stop in
Yeah.
between because I've got some questions. CBD, is that fat soluble? Like, do we need a gallbladder to properly digest it to the point where we can absorb the CBD?
Um, so not necessarily. I mean, the enzymes that the gallbladder releases are not necessarily needed to digest CBD. But here's what I'm going to tell you. The CBD does get stored in the fat cells in the body. Okay. And so what I want you to think of it as is like vitamin D, right? So some people can run, can be deficient in vitamin D, when you test their blood levels, and some people can be normal. Okay. So basically, the people who tend to hold on to fat better have basically an advantage because they're holding on to more of the CBD, and therefore, oftentimes they need to take lower doses and need to take it less frequently. Whereas the people who tend to metabolize their fat quicker may need to take higher doses and take it more frequently as well. Does that help to answer your question?
Yeah, I mean, you mentioned that those with gastric bypass, for example, just they have less intestines, so there's less of a chance of them to actually digest and absorb their nutrition fully. As a result, those who've had gastric bypass can develop deficiencies, like B12 is very common, so they need to be on supplements. And what you're saying is they shouldn't take an edible, either CBD edible or medical marijuana edible, simply because they just won't digest it enough to absorb the medicine. But you are saying that those with digestive issues, like let's say Crohn's or IBS, any kind of absorption issue, someone knows that they have gut inflammation and dysbiosis and they've got some issues with absorption, that edible's out, but that the tincture under the tongue is still okay, and that we can absorb it fully even with a compromised digestive system.
Yes, because it's a different route, right? Rather than being absorbed through the gastrointestinal tract, it's now the tincture gets absorbed through. If you've ever taken a look under your tongue, you'll see all these like blue lines. Those are all blood vessels. Okay, and that's where the cannabinoids are being absorbed is through those blood vessels. And then inhalation, it's being absorbed through your lungs, right? So you're in both situations, you're bypassing the gastrointestinal tract and it's still getting into your bloodstream, is what I would tell you. Now, to touch on like Crohn's disease and ulcerative colitis, which are inflammatory gut conditions, I haven't found absorption of edibles to be as much of an issue as with someone who has, for instance, gastric bypass surgery or even an ostomy. Um, the people with the inflammatory bowel diseases still tend to absorb edibles fairly well.
Okay, very cool. And you mentioned being dosed by weight. So if someone is 100 pounds versus 300 pounds, would they increase their dose of CBD to get the full effect?
So it's actually not by weight, right? Because it actually has to do with the turnover of your fat cells. And you know how some people can be fat on the inside, but fat on the inside, thin on the outside, and vice versa. Okay, fat on the outside and thin on the inside.
Meaning the
So
fat surrounding the organs.
right. So basically, overall, your fat cells, the turnover rate of your fat cells, okay, that can vary from person to person. And how much a person weighs doesn't necessarily contribute to that turnover, right?
Mm-hmm.
I've had small people need small doses and large people need large doses, and vice versa. Large
Mm-hmm.
people need smaller doses, and then smaller people need larger doses. It's really ultimately it comes down to metabolism in general. Okay, then it comes down to metabolism of fats, and then finally it comes down also to what sort of machinery you have in your liver to break down chemicals, because these chemicals are broken down in the liver. So several different factors that come into effect there. So there isn't really, direct correlations make it easy, right? So for X do Y, and for Y do Z. But I haven't found that to be the case with CBD. It's very individual in terms of what dose someone ends up needing.
Got it. What happens when you overdose? I mean, we keep talking about dose. What
Yeah.
if we take too much? What happens when we take too much CBD?
Okay, so a couple different things. One is that the most common side effect is that you'll start to feel lethargic or fatigued, um, and it's almost like a hungover feeling, where you're dragging. And then next most common side effect is you can get diarrhea. And then third most common side effect, and this is more over the long term, you can get changes in your weight and appetite, but that's typically, I would say, rare.
In that the appetite increases or decreases, weight increase or decrease, or is it both?
Typically, there's a decrease in the appetite and the weight.
Okay, um, so overdosing is not harmful, but there are known side effects that are manageable.
Yes, exactly.
Got it. So if you're trying to figure out your dose and all of a sudden you feel lethargic, then you just took too much, and then the next day take less.
Right. Yeah. As a general guideline, yes, correct.
Yeah. How do you what do you recommend for people starting? Like, what's a starting level for a dose? Just to see, is it different for pain versus anxiety, or just do you tell everyone to start with half a dropper full and then go up from there?
No, so everybody doesn't start at the same dose. I've had a wide variety of ranges in which I've had patients start. A lot of it depends on their history, right, and how they've reacted to medications, how they've reacted
Mm,
to what other medications they're on. Okay, also matters. Um, what their medical history is. And the starting dose varies from person to person, and the increment in which they increase the CBD also varies from person to person. And a lot of it also depends on the severity of their condition as well, right? How severe, for instance, their pain level is, or how severe their anxiety is. So those are all the different factors that I'm basing starting dose and incremental doses off of.
Got it. Are there any interactions or contraindications? Like you mentioned interactions with drugs. Are there any known interactions with drugs? And are there any contraindications that would say that we shouldn't do CBD?
Yeah. So, okay. So, in terms of drug interactions, there have been two drugs that have been studied in conjunction with CBD. Okay. So, one is clobazam, which is an anti-seizure medication typically used in children. And what they found was that when clobazam was administered with CBD, the levels of clobazam stayed elevated far longer. Okay. And the danger in that is that you can build up a toxic level of the prescription medication. So in this particular case, in this study, the doses of the clobazam had to be reduced. And that was actually a good thing because the patients were experiencing fewer side effects of the prescription medication. So that's one. Second thing is when they were studying Epidiolex, okay? Epidiolex is basically a prescription version of CBD, okay? And it was approved sometime about in the summer of 2018. So when they were studying this medication, which is essentially CBD, again, they were studying it in a subset of types of epilepsy in children, particularly. And a lot of these children were on valproic acid, otherwise known as valproate, which is also an anti-seizure medication. And what they found was that when patients took valproate with CBD, their liver enzyme levels tended to go up. So it caused a mild liver injury. And typically, they did a couple different things. They either eliminated or reduced the CBD, or they eliminated or reduced the valproic acid, and then the liver enzymes went back to normal. So that's what's known, right? But in the study, what they said was that we would extend our conclusions to any medication that causes what's known as a hepatocellular injury, right? So basically, any prescription medication that tends to cause liver damage or elevate liver enzymes, when these medications are used in combination with CBD, there has to be a lot of monitoring that has to be done, a lot of precautions that have to be taken. So that's pretty much what I would tell you. Now, on my YouTube channel, I do have a video specifically on CBD and drug interactions where I list medications that that a person should use with caution in conjunction with CBD.
I was at the grocery store, I don't know, like a month ago, and talking to the lady that was checking out my groceries about melatonin. And, in my mind, melatonin, over the counter, it's safe. They have like melatonin gummies for children and for adults. And, so it's just like, to me, it's like a safe, like obviously you use everything responsibly, right? So but it's a safe alternative to prescription medications for sleep. And she starts saying, oh, I should really look into melatonin because, and then she lists one of the most common drugs for sleep, Lunesta or something like that. Yeah. And the side effects, right? I mean, are pretty crazy. And she said that she's on a few medications to help her go, calm her down, anxiety, and go to sleep at night. So the checker was, here she's complaining about all the side effects of the medication she's on. And then there's a natural remedy like CBD, right? There's a natural remedy that helps people with sleep, melatonin. She wouldn't try it because she's worried that the melatonin will interact with her medications. And I was just like, this is the weirdest thinking, because I'm coming from the point of like, I don't want the side effects of the medications, right? And she's thinking, I don't want the side effects of a natural substance to interfere with my medications. And she didn't want to be on those medications. And it's like, man, if she could work with her doctor and try CBD and melatonin and like a magnesium soaked bath every night and some kind of like, if she could try these things, which when she, described her situation, she just went straight for the drugs. And I know that over 70% of adults in the United States are on at least one prescription medication. So it's the norm. Her experience is the norm, and my experience of not wanting to be on any medications and looking for alternatives is not the norm. And we're all swimming upstream. We're kind of going against the grain here. And I know my listeners are as well, looking to do everything we can to be as natural and healthy as possible. And there are going to be times where someone wants to use medications and use natural medicine together in harmony. And so I'm glad that you cover where CBD, might interact with the medication, and how we can go about adjusting those things. But in terms of contraindications, is CBD safe for everyone, or are there times when it's not?
Yeah, so I would say it's definitely contraindicated in women who are pregnant and breastfeeding. And the reason I say this, it's a conservative recommendation. Reason being, when cannabinoids in general, right, so CBD and THC have been studied in the context of marijuana, what's been found is that they can lead to low birth weight, and they can also lead to preterm labor and delivery as well. Okay, so that I don't know if I would feel comfortable as the doctor taking that risk, on a person who is pregnant and breastfeeding. And it's important to know that when you are breastfeeding, these cannabinoids do get passed through breast milk.
Mm-hmm. And those studies only for medical marijuana, or are they also for CBD, like exclusively?
They're on medical marijuana. They're not on CBD, right? So it could be now marijuana, and likely, these women are obtaining marijuana off the streets. So it could have been marijuana that was high in THC, but it could have also been marijuana that was high in CBD. That distinction has not been made. So whether it was a THC, CBD, or even something else, we don't know. So it's just at this point, the general category of cannabinoids is what I would tell you.
Right. And we don't actually, there's so many other factors to that. I mean, just to play the devil's advocate, we don't know what kind of group of women that they chose to study, whether they were, what was their socioeconomic position, and how, and if that played a role, right? If they were all unable to eat 3 meals a day, or weren't, you know what I mean? Like, did they have the means to? Were they studying people that were, in shelters and homeless, or were they studying people that were like, and what age, right? Because I can understand low birth weight if you're just stoned all the time and don't want to eat, or if you're stoned all the time on the streets and don't have access to food, is much different, right? So what would it be like if it was women in their 20s who, had a house and a job, and they chose to use medical marijuana while pregnant? And would it be the same? Would it, so it's, or are those other factors, taken into consideration?
Yeah, and I could certainly tell you, even one factor like the use of other drugs was not taken into consideration. And then the other thing is that, one of the other scenarios could have been that, a lot of women get what's called hyperemesis gravidarum. So you get a lot of nausea and vomiting, especially in the first trimester of pregnancy. Mm-hmm. And it, oftentimes can be difficult to control with prescription medications. So out of desperation, these women could have been turning to marijuana off the streets. I highly don't recommend that. But that could have been another scenario that played out as well. So we don't know, right? The CBD hasn't been as well studied, I would tell you, overall as THC. It's now being more and more well studied. But you have to realize, up until just recently, right? Because it was only marijuana has only been very recently accepted. CBD has been only very recently been accepted. These substances, these chemicals, were studied as drugs of abuse, right? And so you're looking at it within a certain lens, a certain perspective, and that has shifted now, where we're now looking at the medical value of it. And so, things are studied differently, is what I would tell you.
Right. they wouldn't turn around and be like, the positive benefits of heroin use during pregnancy. I mean, that's how they saw it, right? So they wouldn't turn around and start telling like the benefits. Like in that study, they wouldn't have been like the women who used medical marijuana or street marijuana while pregnant saw a reduction in their nausea and were in less pain or something. You know, they wouldn't talk about that. So they're addressing those issues, low birth weight and early labor. Interesting. We're just pioneers right now. In a few years, we'll definitely see more studies come out outlining whether or not CBD is safe for the baby during pregnancy or breastfeeding. Because I imagine what's interesting is the endocannabinoid system. You know, our body makes and uses these chemicals anyway. Can we talk a bit about that before our next question about like what is that CBD like attaching to in our nervous system, and why does it complement our body so much?
Yeah, sure. So basically, you have receptors, right? And you can think of receptors as locks. You know, think of like this round circular cell, and it has itty bitty little locks on it. And those locks only accept certain types of keys. Okay. Now, within the endocannabinoid locks, okay, you have CB1. You know, you have even more specific types of locks. You have CB1, you have CB2. And then a group of other receptors which haven't been clearly defined as a part of the endocannabinoid system, but you have CB1 and CB2. And CB1 and CB2 are not just actually located on the nervous system, they're located throughout the body, okay? Even including on your immune cells. So these locks react to certain types of keys, and our bodies make these certain types of keys, right? And they're known as endocannabinoids, right? So if we break that word down, there's two parts to it, endo and cannabinoids, okay? So endo means within, okay? And cannabinoids are these specific types of chemicals that interact with the cannabinoid receptors, okay? Now, the two most common endocannabinoids are anandamide and 2-AG, okay? Now, very similar in structure to the endocannabinoids are the phytocannabinoids. So if we break that word down, you have phyto and you have cannabinoids, okay? So phyto means plant. Cannabinoids, again, these are chemicals that interact with the cannabinoid receptors. And the phytocannabinoids include chemicals like CBD and THC. Okay, so they also interact with these locks because their structure is very similar to the endocannabinoids that we naturally make. And then finally, there are what are known as synthetic cannabinoids, right? So synthetic basically means fake. And so these are chemicals that appear like cannabinoids but are made in a lab. Okay, so we have all these different types of cannabinoids that interact with the body, and when that key enters that lock, it triggers a series of chemical reactions. So going back to this, you know, the serotonin impacting anxiety and the dopamine impacting depression, that's what's going on. It's impacting all these other chemical levels in our body. And, you know, then having an impact, like relieving anxiety, like, you know, putting you in a little bit of a good mood, helping to relieve your pain. So that's pretty much what's going on. And this system was fairly recently discovered, right? We're talking about basically the 60s is when this whole system was discovered. And, you know, we don't know as much about it as other systems in the body. For instance, the opioid system. We know quite a bit about that, but we don't know as much about the endocannabinoid system. But what we do know is that it's significant. It's a significant system in the body. Otherwise, it would not be having, you know, these clinical results that, you know, I've been seeing in patients.
Very cool. Yeah, I found it fascinating when I started learning about the endocannabinoid system. And we had one guest on that talked about how when people are deficient in their fatty acids, so the omega-3 6 and 9, if they're deficient in them, that the body also becomes deficient in the cannabinoids that it
Mm-hmm.
makes.
Yeah.
And that he sees that when people use CBD oil who are deficient in their EFAs, that they see a really positive result, because it's like giving someone a fish oil, or and you can also get them from algae. Doesn't have to be from fish, but an EFA, essential fatty acid supplement, because the body can become deficient in CBD. So it's thought of more like a nutrient, like you said, vitamin D or vitamin C. It's a nutrient the body can become deficient in. And I had a friend tell me recently, it was either a guest or a friend, talk about how we used to have cannabis in our diet. Like hemp was, hemp, 100 years ago or
Mm-hmm.
200 years ago, even 300 years ago, was grown here. We used it, we put it in our food, we fed it to our animals. So then even the milk from the cows would contain some of these cannabinoids, because they'd eat it, they'd give it to the chickens, it'd be in the eggs, and we'd have it in our food, because you can use, hemp. There's all kinds of ways to eat it. But then we would then make ropes and clothing, linen out of it, and the sails and the ropes for ships. But the fact that we sort of had it more in our diet back then than we do now, and I thought that was really interesting. Have you heard about that, or seen that we are like more deficient in CBD now as a society than we were in the past?
Um, No, this is so in the fact that it was in the food supply is actually news to me, and that's something I'll have to look into. But in terms of deficiency, I would say the most objective measure of that is to measure the cannabinoid levels, and just to see whether or not we're deficient, and also what we don't have right now is what's normal, for an individual. How much cannabinoid should a person have? So I wouldn't say. I don't know. I wouldn't use the word deficient, because I feel like then people would start using the cannabinoids as a vitamin on a regular basis. And as I mentioned before, taking too much of it and taking it too often does lead to tolerance. And taking too much of it can lead to side effects as well. So I wouldn't say deficient, but we need more information, like I said, in terms of a baseline, of what's normal, and also measuring these amounts in people.
Mm-hmm. Mm-hmm. Well, as I'm sitting here realizing I don't have any back pain at all, from taking, I took the Eve product, which I've had her on the show, and it was a whole plant. It's a whole plant, hemp plant. So there's CBD in there, but it's like a whole plant. Basically I took 2 capsules. I'm sitting here not in pain anymore. And I was when I woke up, I was, walked around. I woke up with no pain. And that's when I start standing and then moving around. I got to be about 6 or a 7 out of 10 in pain, which is pretty bad for me. And then I took 2, and now I'm just sitting here and all the pain has subsided, it's amazing. I would have been on Advil all day long, and maybe even like a muscle relaxant, if I wasn't into, this. What if I wasn't into holistic health, and I didn't know that there were these options? If I only knew that what the pharmacy had, I wouldn't be taking this natural route. And so it really does work. It really does work to relieve pain. I know we have a question in the group about using it topically. How effective is that, to use like hemp oil or CBD oil on a joint, let's say the wrist or the hand, if the person has an injury or has arthritis?
Okay, yeah, sure. So we do have receptors for cannabinoids in our skin, and uh, in terms of types of conditions that I've seen topicals benefit, they include skin conditions, right? So any sort of inflammatory skin condition, like psoriasis, for instance, eczema, it's effective for. And I've also seen it be effective for very localized muscle pain. Okay, so if you have like a spasm, it's effective for that. What I have not seen it be as effective for is joint pain. So with joint pain specifically, what I find is most effective is both CBD and THC because there's a large inflammatory component there. And so what's going on with inflammation? Remember the autoimmune conditions that I talked about? There's a large inflammatory component there as well. And so you have CBD and THC. They both have anti-inflammatory properties. And when you combine them together, there's an even greater anti-inflammatory effect because you have this phenomena known as the entourage effect or synergistic effect, what it's otherwise known as, going on. And so one chemical is enhancing the effect of the other chemical, and there's even more anti-inflammatory effect. So, I would say if there's mild joint pain, then yeah, the CBD alone can be effective. But if it gets into the realm of being moderate to severe, then you do need some amount of THC in the form of a topical to effectively treat joint pain, such as arthritis.
Very cool. And it's okay to mix and match, like someone uses a topical and takes the tincture, or uses the vapor and uses the tincture, uses the vapor and uses the topical. Like, is it okay to mix and match, or should they just stick with one?
So it's okay to mix the topical with other delivery methods, but other internal delivery methods, but I would not mix and match multiple internal delivery methods, right? Because there's a cumulative effect. These chemicals are getting stored in the fat cells in your body, right? So you can overdo it if you use too many of the internal methods at once. But combining a topical with an internal method should be fine.
When you count, let's say someone goes, okay, I'm doing 100 milligrams a day. I don't even know. Is that how you measure it, by milligrams?
Typically, yeah.
Oh, okay, that's what I thought. Okay, so 100 milligrams a day is my dose. I'm going to do 50 milligrams of topical and 50 of oral. Like, is that how it works? Or do you only count the oral and then topical is just bonus?
So I just count the internal and then the external is just bonus. See, the thing with the external, the topical, is that it's very local absorption. So you're not absorbing enough of it into your bloodstream. And so, what goes into the bloodstream can pretty much be considered negligible unless you bathe in CBD oil. So, you put on some music, some candles, and you pour a lot of CBD in your bathtub. Then, you can get quite a bit of systemic absorption.
I think I'm going to come out with that line of CBD bath bombs, to bathe in CBD. That'd be pretty cool. Awesome. All right, next question.
Why do some people use high quality CBD oil and feel no difference at all? Okay. It could be that the CBD oil has no CBD in it. The fact of the matter is that it's an unregulated industry, right? And so pretty much anything goes. And so really the most important thing that you can do as a consumer is look at the laboratory test results before you purchase the product. And you want to look at the laboratory test result for that particular batch from which the batch from which the product was made, okay? Because every batch is going to have a differing amount of CBD and THC. With the amount of CBD on the laboratory test results, you want to look at the total amount of CBD. And with the amount of THC, you want to ensure that it's less than 0.3%, which is a legal requirement, okay? So that's what I'm going to tell you based on that. Honestly, I don't rely on any of the marketing, on any of the labeling. If I have to judge a product, the first thing that I ask for are the laboratory test results. And the fact that it's that for that particular batch. And one of the things that I'm looking at is the total amount of CBD and the amount of THC. Okay, so let's see here. This next question is actually a really good question. My husband is a DOT driver. He would like to try it for anxiety, but is concerned it will show up on a drug test on the same spectrum THC/marijuana does. Is this true? Does buying higher grades of CBD matter with this? Thank you. Okay, so here's how I want you to think of it, okay? The difference between hemp and marijuana comes down to the amount of THC, okay? So by law, hemp has less than 0.3% THC. Marijuana has more than 0.3% THC. They both have THC, Okay. There's a greater likelihood of the THC being detected with the marijuana product, but there's still, there's less of a likelihood, but there's still a likelihood of the THC being detected with the hemp product. Now, one of the things I want to touch on here are isolate CBD oils. Okay. So the general perception is that, they just take out the CBD from the hemp plant. And they do, but this is done using a series of chemical processes, right? And the types of chemicals that they're using are pentane, hexane. And so one of the drawbacks of this is that you don't know how much of these potentially toxic chemicals get left behind.
Mm.
No one's testing for them, and you certainly don't want toxic levels of pentane or hexane in your body. It can, at the very least, cause a lot of inflammation. So that's one of the drawbacks of the isolate CBD oils. But it's usually the isolate CBD oils that have typically little to no THC in them, and it can even more significantly reduce the likelihood of the THC showing up. However, that's not to say that, there have been products on the market that have been marketed as isolate CBD oils, which are otherwise known as pure CBD oils. But lo and behold, when people get drug tested, there has been THC that's shown up. So again, what I would recommend is go based off of laboratory test results. And if you're going to purchase an isolate CBD oil, what you need to specifically look for are amounts of residual solvents, right? And you want to make sure that they're non-toxic, that the solvents that were used to extract just the CBD have been they've been cleaned out of that final product.
Got it. Yeah, that makes a lot of sense. You don't want those solvents and
Mm-mm.
chemicals in your tincture, that's for sure. Um, Now, I know that you sell a CBD. How do you ensure that it is clean? Um, and is your CBD that you sell going to show up on a drug test?
Yeah, so I drive my farmer crazy, is what I do. Basically, the way it works is that I don't bottle up the product until I approve of the laboratory test results, right? And there's a couple different things that I check for. Number one are the amounts of CBD and THC. Now, the particular product that I've created, it has less than 0.3% THC. It's what's known as a full spectrum CBD oil, which basically means that you're getting, the full spectrum of cannabinoids that are in the plant. It's not just the CBD. So yes, the THC can be detected with the line of product that I'm selling. In addition to testing for the amount of CBD and the amount of THC, I'm also testing for pesticide levels. Now, two pesticides in particular that you absolutely want to make sure your CBD oil has been tested for is bifenazate and myclobutanol. Okay, these are the most commonly used pesticides on hemp plants. Again, it's an unregulated industry, and so there's no control over what can and cannot be used in terms of pesticides on hemp plants. The other thing is I also test for fungus and bacteria, and this is because this is especially important in people who have compromised immune systems, right? So this can include anybody who has who's undergoing chemotherapy, for cancer, for instance, anybody who has HIV/AIDS, anybody who has had an organ transplant, but also for people who have autoimmune conditions and are on drugs that suppress the immune system. So basically, hemp is a plant. So it's just like romaine lettuce. It can have E. coli, it can have salmonella, and it can even have a fungus known as aspergillus. And the people who are most vulnerable to these bugs are the people with compromised immune systems. So that's another thing that I make sure of. The other thing is heavy metals. Okay, and this is important because the hemp plant and even the marijuana plant, they're known as bioaccumulators. So they just soak up heavy metals in their environment. Okay, and that those heavy metals can seep into your CBD oil. There have been toxic levels of like lead, for instance, found in CBD oils. Now, the 4 heavy metals in particular that you want to make sure your CBD oil has been tested for include arsenic, cadmium, lead, and mercury. Okay. And then finally, the other thing is, which I touched on before, are residual solvents. So there's unsafe solvents, which I touched on, and they fall under the category of hydrocarbons, right? So we're talking about things like pentane, hexane, butane, propane. And if some of these chemicals sound familiar, it's because they're used for everyday things. Like propane, for instance, is used to fire up your barbecue grill. Butane is what's in lighter fluid. So if any of these chemicals are used, and like I said, they're more commonly used in isolate CBD oils, you want to make sure there's non-toxic levels left behind, that they've been cleaned out. Now, the safer solvents on the market that are being used more and more are carbon dioxide, CO2, the gas that we breathe in and out every day, and also alcohol. Okay, so those are the safer, more safer solvents that are used to make CBD oils. So those 5 things at the minimum. But when I was creating my line of CBD oil, I was asking farmers all sorts of questions, like what sort of growing practices are you using? Where are your hemp plants being grown? For me, I wanted to ensure that they're grown in the United States, because specifically in Colorado, because that's the one state where there is some control in terms of regulation, on the production and cultivation of hemp. So a variety of different factors, but these 5 that I walked you through, you especially want to make sure with any brand of CBD oil that you're buying.
I've heard, so maybe you can clarify that. So I know with medical marijuana, there's indica and sativa. There are these different sort of strains of it that instead of thinking of it as one plant, we think of it like mushrooms, where there's shiitake mushrooms and reishi mushrooms. And so there's many different kinds of mushrooms, and each can have a different medicinal quality to it. Same with the cannabis and the hemp plant, that they have sort of different strains that will provide different benefits. Is that true with hemp as it is with cannabis, that is there like a sativa and an indica of hemp to get different kinds of THC, or different kinds of CBD?
Yeah, so here's how what I would tell you, right? So I don't actually go by the names of the different strains, indica, sativa. I don't care about all that. As a doctor, what I care about is objective data, right? So all I care about are the amounts of CBD and THC, right? So when you're looking at marijuana products, what you want to look at is the amount of CBD relative to THC, or the amount of THC relative to CBD, plain and simple. When it comes to hemp-based products, you're looking at the total amount of CBD. Number one, you're making sure that the amount of THC is less than that 0.3%. Then you're going to look at the amount of CBD and look at what the total strength is, okay, in that 1 ounce. So remember, you want to compare equivalent amounts. So an ounce to an ounce, not an ounce to 2 ounces, for instance. I mentioned this before, but I want to emphasize it again. Typically, what you're going to find on the market is anywhere from 250 milligrams of CBD to 100 milligrams of CBD in a 1 ounce bottle. Okay, so when it comes to hemp-based products, you're looking at strengths. Okay, and more is not always better, right? Like I mentioned before, optimal is what you're aiming for. The strength that's right for you. And just to give you an example that's relatable, let's take ibuprofen. So ibuprofen is used for headaches, okay, oftentimes. And you have the person where, they come in 200 milligram tablets. You have the person where, 200 milligrams does the job of relieving their headaches. But then you have other patients that need hundreds of milligrams, and it comes in the form of prescription strength to help relieve their headache, right? So the person where 200 milligrams does it, of ibuprofen, you're not going to have to take hundreds of milligrams to help relieve your pain. So same thing with CBD, for one person, the 250 milligram strength does the job. And so you don't need to go all the way to the other end of 1,000 milligrams to relieve whatever symptom you're experiencing. Does that help in terms of, so it's
Yeah.
not strains, but it's strength of CBD that you're looking at.
Okay, so don't be worried about the strain of the plant. We're just looking at the amount of CBD. Now, your CBD oil is whole plant, meaning it's the
Mm-hmm.
whole plant extract. So there's actually more than just CBD in there. There's the terpenes, and I mean, I don't even know these words, but do you ever look into sort of the medicinal benefits of the other compounds that come from the hemp plant?
Okay, so here's the interesting thing with terpenes. Terpenes are highly volatile compounds, and that's why whenever you're near a lemon grove, what you're smelling is a limonene kind of floating around in the air. Or when you go to when you're near pine trees, you're smelling the pinene that's floating around in the air. So they're highly volatile compounds, and when CBD oils are made, the heat process is high enough where these chemicals evaporate. So oftentimes, really what's going on with the manufacturing process is that these terpenes are being added back in after the CBD oil is made. And then it finally, so the laboratory testing goes through several phases, right? So one, you test the plant. Second, you test the extract. And then third, you test the final CBD oil. Okay. So let me sort of simplify this for you. So you think general perception is that it's just the CBD extracted in the oil, right? Like the kitchen grade oil, the coconut oil, or the olive oil. That's not the case. What's going on is that the CBD is extracted in a solvent, right? One of the solvents that I mentioned, CO2, ethanol, or one of the hydrocarbons. And then once it's extracted in that, then it's being mixed up in the oil, right? So the plant is tested, because if the plant is no good, like if it's infested with fungus, E. coli, salmonella, then you can't use it. Then the extract is tested, because you want to make sure that in the heating process, you're getting the right amounts of CBD and THC, right? And then finally, once it's dissolved in the oil, you're testing it again, for amounts of CBD, amounts of THC as well. So once the CBD oil is made, put into that oil, then typically the terpenes are added back in. And it's usually, you can buy terpenes online in powder form, and it's mixed back in. So that's typically what happens. And it's interesting because there's been research done on this too, where they just took a little bud of marijuana, because marijuana has terpenes as well, and they put it in boiling water. So they tested it for terpenes before they boiled it, and then after they boiled it, and most of the terpenes disappeared after putting it in boiling water. Because, like I said, they're highly volatile compounds, and they just very easily, any amount of heat that touches them, they sort of are in the air.
What are their medicinal benefits?
Um, the main medicinal benefits, as far as I know, come from the cannabinoids themselves, because that's what's interacting with the cannabinoid system. Now, the terpenes could be interacting with other systems in the body, but the two combined, I haven't found much in the way of research. So it's difficult for me to say.
You know what I find really interesting about CBD is that if
Mm-hmm.
someone smoked too much pot and they're too high, that they can use CBD
Mm-hmm.
to bring them down really quick, because the CBD floods the receptors and blocks the THC receptors. So if someone, did too much pot, like maybe it's a medical marijuana patient for the first time and they're going through chemotherapy, or they're, in a lot of pain and they're looking to relieve themselves, and they're okay with getting high, because whatever, they're at home. And then they feel too high. Maybe they get paranoid or scared. If they take some CBD, then it all of a sudden will bring them back to reality much faster. I mean, we don't have that like with alcohol. The old saying is, drink some coffee, but now you're just drunk and awake. It doesn't actually like speed up your liver to metabolize the alcohol much faster. So when you drink, it's like, well, you're just going to be drunk for the next 4 hours, or if you're high, you're just going to be high for the next 4 hours. But with CBD, it actually can bring people down faster, and I thought that was really interesting. I did not know that. when I was younger and might have benefit from that information.
Yeah, all the college students and the high school students, yeah, probably.
Right, right. And I don't know if it's anecdotal, but I heard that that EMTs will have CBD in their kit to help patients who or help the people they're helping that might have eaten too many pot brownies and then called 911. Have you heard of that? That EMTs would travel in their ambulance with CBD oil?
I have not actually heard of that. Do you know which country this is in? Is this
I
in
mean, it was
Canada?
anecdotal. I don't know if it's true or not. It'd be really interesting to find out. But I heard that because CBD is so effective at bringing people down, that EMTs have been using it. So I don't know. I don't know if it's true or not. But it's interesting to consider that it has that effect. Now you said that during the testing that there are three times you test. So you're testing at the farm, basically. You take the plant itself and have it tested. And you're testing for mold, the CBD level of the plant, and pesticides. Is that correct?
Yes, you're testing for, yes, the bugs, the pesticides, and also you're testing for the amount of CBD and THC.
And then,
Well, actually, at that point, the amount of CBD and THC doesn't really matter. I mean, not the CBD, but the THC. You want to make sure it's less than a certain amount. But during the extraction process, based on the heating, you can actually use a heating process to change the amounts of the CBD and the THC.
okay, so that's not as important. The first time you test, it's more about whether this plant is even worth taking it to the factory
Yeah.
or to make it into a tincture, to make it into medicine. You want to make sure there's no mold. You want to make sure there's no pesticides, and or that they're below the limits that you're looking for. And then after you've had it made in the lab is when you test it again for the CBD levels and the THC levels. And then you said there was a third time you tested. Can you just clarify that?
Yeah, so just to go through the whole process, so you're testing the plant mainly for things like pesticides, fungus and bacteria, and heavy metals, and then you're going to test the extract mainly for the amounts of CBD and THC. Um, and then lastly, you're going to test the final product for amounts of CBD and THC, and then also like residual solvents, heavy metals, okay,
Mm.
pesticides, and then you don't really have to do fungus and bacteria at that point. But those are the main things that you're testing for at the third stage of it.
Got it.
Now, this is how I do it,
Right.
and ideally how it should be done. But is this how everyone does it? No, because again, there's no regulations in the industry. I just tend to be very, very type A and use the knowledge that I have very strictly. But yeah, this is how I've worked with my farmer and done it.
Very cool. A question just came in from Jody. They say, I've been seeing citrus forms of CBD with zero THC. How well do these work? And if you have zero THC in your body, how well is it going to react with your system? Or what would you do when your body builds up a tolerance? Okay, so there's a few questions in there. So one is, um, what are citrus forms of CBD?
I don't know actually. I was going to ask you the same question.
Maybe it's the edibles, or maybe it's like citrus flavored tincture. Okay, so they say it's with zero THC, which means the manufacturer had to have used all those solvents to
Hmm.
remove it. How well do these work? So, in your
So
experience, how well do the ones that have the solvents that have removed the THC work compared to the whole plant CBD?
okay, so it's going to depend on the symptoms that you're experiencing, right? So if it's a condition that really doesn't necessitate any amount of THC and it really is benefited by high amounts of CBD, then it's going to benefit you. But if it's something where you do need some amount of THC, then it's not going to benefit you. So it really depends on the combination of symptoms that you have. And then, like as in the example of joint pain that I gave you, if you have mild joint pain from arthritis, then yeah, it could help. But anything more than that, moderate to severe, then in all likelihood, it's probably not going to help. And what would you do when your body builds up a tolerance? You scale back. That's pretty much the simple solution to it.
Got it. Very cool. Yeah, a friend once told me that so he was doing medical marijuana, and he found that when he added CBD, that he needed to do less medical marijuana to get the same results. So he found it actually made his body seem more efficient with it. Have you heard of that?
Yeah, so if you think about it, if it's a product that has high amounts of THC, it still does have some amount of CBD. And if your body is benefiting from the CBD, you're going to have to use more of it to accumulate more of the CBD, right? Those um, the smaller amount of CBD you're going to have to take more of in order to accumulate some amount. But then if you add in the CBD, then you're not going to have to take much of the high THC, low CBD product. Does this make any sense? Hopefully I haven't confused you.
I think
So
so.
okay, so let's put numbers to it. Okay, so you're using a marijuana product that has 10 milligrams of THC and only 2 milligrams of CBD. And say your body really needs 10 milligrams of CBD for it to be effective, right?
Mm-hmm.
So you're going to have to take a lot of that to accumulate to 10 milligrams. But if you add in a CBD product that has 8 milligrams of CBD in it, and then you add it with the 2 milligrams that's already there, you're obviously not going to need as much of the other product.
Mm-hmm. Yeah, that makes sense, because what the body actually was really benefiting from is what you're saying is when people use medical marijuana, what they're really benefiting from is the CBD in the medical marijuana plant.
Right, yeah, for certain conditions. And so if that's what your body really needs, it's going to like keep on asking for more until it gets enough. But if you give it the high CBD product that has the right amount, then it's
Mm-hmm.
not going to ask for more, and it's going to do the job.
Yeah. I know of someone, actually, I think I know of a few people, because I've heard this more than once, but I know of someone, I watched them do it. They use CBD, pure CBD, to quit using marijuana, that they had been using it recreationally, and they found that they used it for like 4 years nonstop every day, and they every time they went to stop, they didn't want to stop, and they felt as though there was an addiction there. And I know it doesn't have the same, it's not addictive like cigarettes or heroin. I get it, but for people who are doing it every day, and they're seeing some kind of like relief in their life, especially if they have anxiety, and then when they go to stop, they feel compelled to keep doing it. And so I've talked to people who feel like that marijuana has that addictive nature for some people, just like chocolate bonbons would. It's not that it can be helpful, but it can also, some people can find that they don't want to quit. And I know someone watched them do it, where they used the CBD extract, and it helped them to want to quit. And they used it, and they had to do the work, so that they need to face life, and face life sober, right? But that when they used the CBD, that it brought on all the same positive benefits, like the lowered anxiety, the better sleep, all that. And they found it much easier to not feel like they wanted pot anymore. So it kind of gave them a relief from the craving. Have you ever heard people using CBD to help quit using marijuana as a recreational drug?
Yeah, so I want to put it into context here. Sounds like the person that you're talking about overdid marijuana use,
Right.
by
Yeah.
quite a bit. And so, like just like any other chemical, like any other drug, if you abuse it, then yes, there is a potential for addiction.
Sure.
So that's important to know. Now, chemically speaking, CBD is what's known as an allosteric inhibitor of THC. So, when you have the CB1 receptor that I was talking about, and CBD attaches to it, it changes the shape of the place where THC attaches, and so the body no longer gets any sort of effect from the THC anymore. So that is potentially something that could be going on in terms of reducing the effect of the THC and therefore the need for it as well.
Very interesting. Okay. Anything else you want to make sure that we cover?
We covered quite a bit. And I would say that, if your listeners want more information, I am constantly answering questions on my YouTube channel. And actually, starting next week, what I'm going to do is I'm going to try to go live every day on the various different platforms and answer questions for people because people want answers. And so they can post their questions on YouTube, on any of my social media platforms, on Facebook, and I'll select them because I do get a lot of questions, so I'll select them to answer them. And
Very
then
cool.
There's more information in my book as well. Some of the things that I mentioned, I go into it in a lot more depth in the book, and that's available on Amazon. It's titled The CBD Oil Solution, and then the subtitle is Treat Chronic Pain, Anxiety, Insomnia, and More Without the High. Got
it. And I'm going to make sure that the links to everything that you do is in the show notes of today's podcast at learntruehealth.com. I am currently on your website and looking at your hemp oil and the CBD oil solution book. We'll make sure the link to that is also in the show notes. People can join your email list and it immediately gives them some great information. And then, of course, follow you on Facebook. I've been following you on Facebook since episode 49. When you were first on the show, and I see you posting all the time. Oh, and on Instagram, I see you posting all the time pictures of like lectures that you're giving and slides and all kinds of interesting stories as you navigate this world, educating people on the benefits of CBD. So it's been a lot of fun actually following you and seeing how you progress and how you've been really shining a light on this great information. Because if we can use CBD instead of, or use it to reduce pain medication, I mean, right now, being in the opioid epidemic that we're in, if we can use anything natural just to help people either prevent ever needing to get on opioids or help them to get off of it or help it to reduce it, all of that is a benefit. And just like my experience sitting here, I am so grateful I'm not in pain right now sitting here because I've, like I said, injured my back. And I'm just thinking about that I would have absolutely taken over-the-counter drugs or prescription drug had that been offered to me if I didn't know of the benefits of using hemp for pain reduction. So it works, which is great. And I would say that it's, if we're going to talk about the opioid epidemic in the context of a solution, then I think CBD oil is it. Absolutely. Well, and you've been helping people in both in a clinical setting one-on-one as with a doctor-patient experience, and consulting people around the world. So you've had that experience of working with people, helping them to use CBD and use medical marijuana to get off of drugs, to get off of prescription medication, to lower prescription medication, and also with their medications. So you've actually seen hundreds of people be successful using these methods. Do you have any success stories that you would like to share specifically that come to mind in terms of using CBD in getting off of pain medication or reducing pain medication? Oh gosh, like so many, thousands of stories. But specifically what comes to mind are my patients with fibromyalgia, because that's a condition where that tends to be very resistant to conventional medications. And, these patients, the medications are just piled up on top of them, to the point where they're taking like essentially a cocktail of prescription meds. And, a lot of times, they'll go back to their patient, to their doctors and complain that, this isn't working or that isn't working. And, these patients get dismissed that, they're told that it's all in your head, that the pain that you're experiencing is in your head.
And, when these patients have come to me, I've put them on a regimen of CBD and or THC, and they're in tears. They're saying, Dr. Patel, nobody's believed me for the longest time. I've been trying drug upon drug upon drug, and now I'm at the point where I can manage my pain with just, the form of cannabis that I'm using. And I think that's tremendous, both on the patient's end and on my end, to be able to witness that, to be actually be able to solve someone's problem from my end, but for the patient to experience that sort of relief, because they're prisoners to their medications, medications that aren't working for them, and now they're using this medication on an as needed basis to help manage their pain. So it's a lot of freedom that comes with it.
Absolutely. I'm so excited to hear that. That's phenomenal. Well, I continue to look forward to learning more from you and following you on Facebook and watching your live Facebook and Instagram videos and seeing all the questions come out of the woodwork. And seeing what happens in this industry over the next few years. Like I said, we're pioneers. We're just starting. It's all just starting out since it's legal now. And we can see the studies start to come in and the results start to come in terms of all the benefits that CBD can provide us. So it's very exciting. Yeah. Now I do have a question. Would you like to participate? And I can edit this out if not. But would you like to participate in providing something to like a drawing for the group, for the Facebook group?
Yeah, we could do a free drawing for a book. And what I can do is I can put up a post. Do you have a group? I think you have a group, don't you?
Yes, the
Facebook group?
Yeah, Learn True Health Facebook group.
Yes. Okay. And I think I'm actually a part of it. What I can do is I can put a post. Actually, I'll share a post through my page, and then that can, just be shared. And whoever, it's worked for me before, but basically whoever shares it, likes it, tags other people, will end up winning a book.
Awesome. That'd be great. Yeah, normally I do the post in the Facebook group, but you can do the post. It's totally fine. So listeners, just jump into the Facebook group after listening to this. Go to Learn True Health in Facebook, find the group, or you can go to learntruehealth.com/group. That'll redirect you to the group, and then look for Dr. Patel's post, and we'll have it up for about a week after we publish this episode, and comment in order to enter to win her book, to win it for free.
Okay, awesome.
All right, fantastic. Well, it's been wonderful having you back on the show. Is there anything that you would like to say to wrap up today's interview, or anything left unsaid?
No, I would just tell your listeners just to tune in on my YouTube channel, and I'll continue to answer more questions on there.
All right, fantastic. Well, it's been great having you back on the show.
Thank you for having me. I appreciate it.
Hello, True Health Seeker. Have you ever thought about becoming a health coach? Do you love learning about nutrition and how we can shift our lifestyle and our diet so that we can gain optimal health and happiness and longevity? Do you love helping your friends and family to solve their health problems and to figure out what they can do to eat healthier? Are you interested in becoming someone who can grow their own business, support people in their success? Do you love helping people? You might be the perfect candidate to become a health coach. I highly recommend checking out the Institute for Integrative Nutrition. I just spent the last year in their health coaching certification program, and it really blew me away. It was so amazing. I learned over 100 dietary theories. I learned all about nutrition, but from a standpoint of how we can help people to shift their life and shift their lifestyle to gain true holistic health. I definitely recommend you check them out. You can Google Institute for Integrative Nutrition, or IIN, and give them a call, or you can go to learntruehealth.com/coach and you can receive a free module of their training to check it out and see if it's something that you'd be interested in. Be sure to mention my name, Ashley James, and the Learn True Health podcast, because I made a deal with them that they will give you the best price possible. I highly recommend checking it out. It really changed my life to be in their program, and I'm such a big advocate that I wanted to spread this information. We need more health coaches. In fact, health coaching is the largest growing career right now in the health field. So many health coaches are getting in and helping people because you can work in chiropractic offices, doctors' offices, you can work in hospitals, you can work online through Skype and help people around the world. You can become an author. You can go into the school system and help your local schools shift their programs to help children be healthier. You can go into senior centers and help them to shift their diet and lifestyle to best support them in their success and their health goals. There's so many different available options for you when you become a certified health coach. So check out IIN, check out the Institute for Integrative Nutrition, mention my name, get the best deal. Give them a call and they'll give you lots of free information and help you to see if this is the right move for you. Classes are starting soon. The next round of classes are starting at the end of the month. So you're going to want to call them now and check it out. And if you know anyone in your life who would be an amazing coach, please tell them about it. Being a health coach is so rewarding and you get to help so many people. Are you looking to get the best supplements at the lowest price? For high quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com and one of our fantastic True Health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. Takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program.